So functionally, for people to move through life and not put small joints that are in the spine at risk and bending over excessively, we would want them to have the same function of squatting, such as a 1-year-old just learning how to walk, or a 105-year-old centenarian in Okinawa that averages 50 squats a day, according to the longevity studies conducted by National Geographic on those 5 blue zones of the world where people commonly live over 100. If certain muscles of the hip joint lack the flexibility of a normal person, they will be limited on the depth of their squat and not compromise the back. So if I asked Kate to squat and I gave her assistance, that would be normal range where her pelvis goes lower than her knees so that her hands could easily touch the floor. Then in people that lack that flexibility, frequently one of the muscles that's very tight is the short hip adductor group, which are the inner thigh muscles, of which there are 5. Frequently, people will think they're stretching that muscle when they sit on the floor with their soles of the feet together. You're sitting on the floor. And the soles of the feet are together, and then they pry the thighs apart, trying to do a stretch to this muscle. If we look at Kate from a side view as she faces that direction, the danger of this is that we have the vertical load of gravity upon their back and these small joints that are at the very bottom. With the hip joint flexibility compromised, the chances of this rounding here, where we know for a fact that the lumbar disc pressure is exceedingly high, especially the more they press and the more they pull in their ankles, besides the risk of stretching the ligaments that span from each lumbar vertebrae when they hunch over and try to get this muscle group stretched. So we consider this a very risky and dangerous way to try to address the inner thigh muscles when they're short. Instead, we have a position whereby her knees are on each pad facing that direction. Hands are on the floor. Okay, and then we ask her to slide with her knee, even with her hip joint. We ask her to slide the 2 knees away from one another. And you can see that she does. And then we ask her feet to be about shoulder width, similarly to when she would squat and have the most optimal distance of her feet apart when she's performing that task. Next, as she uses her hands out in front of her shoulders, she's going to be pushing her body rearward, and it's very conscientious to activate the low back muscles to keep the tip of the tailbone up maximally. The tip of the tailbone is going to want to round and fall this way, thus leaving the back in a vulnerable position for those ligaments if the ligaments are already getting too loose. So we do not put the ligaments at risk, and we activate the low back muscles to keep the tip of the tailbone up. Then she should feel it only in the inner thigh. So it should be right here on both sides. And then in this way, you'll also note that she's horizontal to gravity and not vertical to gravity. So the risk on the back, whose joints are in their mid-range, is also in an unloaded or anti-gravity position. We think about this position, and it is very close to the squat position itself if you imagine her to be on her feet. Another muscle group that can limit the depth of squat could be the hip extensor called the gluteus maximus. So if you note when Kate performs the squat and the knees go apart, this muscle would be extending, or this muscle would be lengthened, and then it would be the power muscle to bring her up. if it was too tight, then she would not be able to get to the depth that hers is able to lengthen. If we look at the anatomy chart, this muscle is located right here and coming down with many fibers attaching to the IT band and other fibers attaching to the back of the femur in here. So we have a stretch for that, and I'll ask her to kneel with her right knee on the pad, and then she's on her hands and knees, and the left leg would be behind them, so that you would straighten this leg and cross it behind your right glute. Okay, then the right knee would be placed under the navel. So it started out under the right hip, but then it is placed under the navel, and then the right foot is drawn toward the left wrist. That rotation will cause the muscle to already begin to tighten up. Now, because this is targeting the right gluteal tissue, which attaches in here and comes down and attaches to the femur and the IT band, then we must target that muscle specifically and make sure the back does not round and move out of the mid-range position that it is in, as well as being horizontal to gravity. So right now this pelvis on this side is too low, so you would elevate it up, and then as you note the knee under the navel and you drew an imaginary line from pubic bone, navel, and up to your sternum, the right knee would always be on the floor and under that imaginary line of your mid position of your body. Then, as you move backwards, you would note that the knee is staying along that midline and not deviating. And then you would use these muscles in the low back to make sure the tailbone doesn't fall. And when you reached a position where you felt stretch in the gluteal tissues, you would stop at that position and wait for the muscle to accommodate and lengthen as seconds would tick by. After about 30 seconds, then it would be okay to move into a position of greater tightness as long as the tip of the tailbone stayed elevated up, using the low back muscles to maintain that position. If the person goes down to their elbows and bows their head, there's going to be a tendency for this to round and therefore put the low back at a heightened risk of being out of mid-range when we want to target this area and not stretch out the low back. So I recommend that the hands could be out in front of the shoulders, and then they could push the body back if the muscle needed more range. Okay, another tendency that one must be cautious is that the side that's getting stretched may get lower than the opposite side. So we would say, do not let the side getting stretched fall below its counterpart on the opposite side. So for tight people, this stretch might last for 3 to 4 minutes. On people who are trying to maintain flexibility and have normal flexibility, then we would say, do the stretch a minute per side to address each glute.